Vayu Mudra. Procedure to do. Vayu Mudra is formed by bending the index finger, along with the thumb, and placing it on the base of the thumb, applying slight pressure with the thumb. While it can be practiced in any sitting posture, its effectiveness is enhanced when done in Vajrasana. Practice it for a duration of 15 to 45 minutes, depending on your capacity. This mudra helps pacify aggravated air quickly. For acute or chronic wind-related ailments, daily practice of this mudra is recommended. Once the condition is resolved, it's advisable to discontinue practicing Vayu Mudra to prevent any adverse effects. It is a reliable remedy for 84 types of air-related disorders. In Vayu Mudra, the Vata nadi is influenced, rotating the wrist left and right while in this posture aids in alleviating cervical pain. Advantage: Vayu Mudra is effective in treating various Vata-related disorders, including sciatica, paralysis, back pain, indigestion, muscle tremors, rheumatism, colic, knee, joint pain, and conditions associated with excessive air. Alleviates pain originating from imbalanced Vayu dosha in the body. By manipulating the left nostril and right nostril, it provides quick relief. When incorporated into meditation practices, Vayu Mudra helps reduce mental restlessness, provides relief from back pain and cervical pain. Beneficial for heart conditions, vomiting, hiccups, belching, hysteria, cholera, wind-related disorders, blood pressure, polio, neck pain, burning sensation in the feet, and jaundice. It also improves blood circulation. When practiced in Vajrasana, along with eye closure and chanting Om, it rapidly enhances eyesight. Helpful in managing diabetes. Remember, for swift relief from Vayu-related ailments, it's advisable to practice Prana Mudra in conjunction with Vayu Mudra. This combination enhances the life force. Air elements within the body can fluctuate. Recognizing these fluctuations and striving for balance is crucial for well-being.